Steps towards independence. Occupational therapy and its role in autism. Autism spectrum disorder is classified within neurodevelopmental disorders. It has a biological basis and is characterized by persistent difficulties in communication and social interaction, as well as the presence of repetitive patterns of behavior, interests, and activities. Among the aforementioned difficulties, there are also sleep disorders, including difficulties in initiating and maintaining sleep, and frequent nocturnal awakenings. Early detection is considered necessary for individuals with this condition and their families, as it would allow for their incorporation into various treatments adapted to their development. The essential objective of the diagnostic evaluation of autism is to ensure adequate support and guidance. When the first detection or suspicion occurs, children should be referred to a specialist for a comprehensive evaluation to establish the diagnosis. Accurate and appropriate diagnosis generally requires contributions from multiple disciplines to assess the core symptoms, functional impairment, and severity of the case. Within the multidisciplinary evaluation, auxiliary tests are included such as language assessment from speech therapy, psychological evaluation from psychology, and sensorimotor assessment conducted through occupational therapy, among others. However, the latter is one of the most requested disciplines by families of children with autism spectrum disorder. In the audiovisual material that we present to you, we will try to explain everything related to occupational therapy and its benefits in the treatment of individuals diagnosed with autism. A bit of history. The origins of occupational therapy date back to around 1917 when occupations for men confined in Canadian military hospital wards were introduced. Basket weaving, knitting, board games, among others. The purpose was to provide mental stimulation and an intermediate situation between chronic disability and leisure. Do you know what occupational therapy is? The World Health Organization defines occupational therapy as the set of techniques, methods, and actions that, through activities applied for therapeutic purposes, prevent disability and maintain health, promote the restoration of functions, compensate for disabling deficits to increase functional independence and the possible reintegration of the person in all aspects, work, mental, physical, and social. If you're enjoying this video, give it a like and don't forget to subscribe to our channel. Your support allows us to continue creating quality content especially for you. The main objectives of occupational therapy are: prevent or reduce disabilities and obstacles that arise as a consequence of physical, mental, sensory, or social disorders, preventing the person from functioning independently in their environment. Restore lost function by improving residual capacities and adapting the environment to the person's needs. In early childhood, occupational therapy generally focuses on improving sensory processing, social performance, self-care, and participation in play. In young adults, the focus of occupational therapy can include social and behavioral performance, transition to work, and independence in the community. What are the areas that can be addressed through occupational therapy? Basic activities of daily living. These are activities that are oriented towards taking care of one's own body, dressing and undressing, feeding, eating, showering, personal grooming and hygiene, and functional mobility. Among the self-care tasks included in the activities of daily living, feeding is one of the most addressed in therapies. The degree of independence in this activity is assessed, analyzing the actions that involve bringing food to the mouth. The ability to grasp objects and the use of utensils for eating and drinking are evaluated, creating adaptations if necessary for each of them: plates, cutlery, and glasses. Instrumental activities of daily living: pet care, community mobility, making small purchases of motivating items, accompanying parents to do shopping and participating in making the shopping list, food preparation, and cleaning. Rest and sleep. Participate in routines that lead to preparing for sleep. Education includes activities necessary for learning. Work. In the case of children at school, organizing tasks or sitting down to do homework. For adults, it includes household chores, watering plants, dusting, making beds, sheltered workshops, making a product in series, job orientation and reorientation. Play. For the purpose of both mental and physical relaxation, alleviating stress and using fewer medications, for example, music therapy, relaxation, gymnastics, parlor games, television. Leisure and free time. A non-obligatory activity in which the autistic person freely participates and where they explore their interests. Social participation. Participation in activities such as birthdays, excursions, visits to parks, among others. What role does the occupational therapist play in the treatment? The occupational therapist understands the social, emotional, and physiological effects caused by certain diseases, injuries, and special conditions. Therefore, this allows them to assist in promoting skills for independent living in people with autism and other developmental disorders. The occupational therapist works as part of an interdisciplinary team that includes parents, teachers, and other professionals, enabling or rehabilitating the individual to provide them with the necessary resources to integrate or reintegrate them into their daily life. Their help is directed in two main ways: evaluation and therapy. The therapist conducts an assessment of the individual's abilities, establishing the objectives to be developed in the treatment plan and continuously evaluating the results, assessing the degree of independence, enhancing skills for everyday situations, and improving general functions. All of this is carried out through activity, which is the essence or tool of treatment, understanding it not as an end, but as a means to achieve the general objectives set by the therapeutic team. Occupational therapy in children with autism spectrum disorder. It is important to carry out a transdisciplinary approach in children with autism, where all agents working with them enhance their strengths and neutralize their difficulties, achieving adaptive behavior. Examples of occupational therapy activities for children with autism spectrum disorder. Children with autism experience sensations from their muscles and joints more intensely compared to those from their eyes and ears. Activities such as pulling or pressing their limbs, being gently compressed with cushions, or being responsible for unloading shopping bags provide them with extensive information about their body and help them become more self-aware. Providing opportunities for movement is another effective strategy to encourage interaction. Movement increases the child's level of activation, thus making it easier for them to pay attention to and connect with their surroundings. Engaging in detailed physical activities, such as threading beads or assembling puzzles, is crucial in helping the child develop coordination and body awareness. Additionally, performing everyday tasks that promote development, such as brushing teeth and combing hair, are equally important. Another set of useful strategies focuses on the development of communication skills. These techniques are essential for improving the child's interaction and both verbal and nonverbal expression. Using visual cues at home and in frequently visited places is an effective tool for organizing the child's thoughts and expressions. Anticipating and structuring time using visual signals, such as calendars and schedules, is also beneficial. Furthermore, we can support children with autism spectrum disorder by promoting regulation strategies, which help reduce the frequency and intensity of tantrums. It's crucial to customize the strategies used, as there is no one-size-fits-all solution. They must be tailored to the individual characteristics and specific context of each child. By focusing on these skills during occupational therapy, children with autism can make significant progress. These include developing relationships with peers and adults, as well as improving their ability to concentrate on tasks. Furthermore, occupational therapy helps children with autism to more appropriately express their feelings, engage in play with peers, and enhance their self-regulation skills. Occupational therapy in adults with autism spectrum disorder. Adults on the autism spectrum often face challenges related to social interaction, motor skills, sensory processing, and repetitive patterns of behavior and intense interests. These difficulties can significantly impact their ability to perform daily activities. Increased awareness and knowledge of autism spectrum disorder have opened up numerous avenues to assist those affected in adapting to the demands of daily life. Occupational therapy is one of these significant support pathways. Sometimes, certain situations or barriers can interfere with a person's ability to complete or independently participate in daily activities. These difficulties may involve physical, cognitive, emotional components, or a combination of these. As is the case with autism spectrum, it is crucial to first assess which components are affecting the individual's performance, and then begin an appropriate correction or compensation process. Examples of occupational therapy in adults with autism spectrum disorder. An example of cognitive deficit is the difficulty in following instructions due to decreased attention. The treatment plan may involve altering the environment to reduce visual and auditory distractions, or implementing compensatory techniques such as timers, breaks, and providing guidelines and schemes for tasks. For instance, Amalia is a young woman on the autism spectrum who dislikes shopping. She finds it too noisy and chaotic. After several discussions, Amalia and her occupational therapist determined that she had difficulties processing sensory information. The noises and sights at the mall were overwhelming for her. Together, the young woman and her occupational therapist devised a sensory program and compensation techniques that eventually enabled her to successfully complete her shopping. The sensory program consisted of exercises that, when performed regularly, helped Amalia to better process sensory information from her environment. Compensation techniques included shopping at smaller stores during less busy times and practicing social scripts. A social script is a form of role-playing to rehearse interactions before they actually happen, which helps to increase confidence and skills. This is just one example of how occupational therapy can enhance a person's ability to participate in daily activities and improve their level of independence. These are some of the skills that occupational therapy can foster. Fine motor skills required for holding objects while handwriting or cutting with scissors. Gross motor skills used for walking, climbing stairs, or riding a bicycle. Perceptual skills, such as distinguishing between colors, shapes, and sizes, as well as the ability to maintain proper sitting posture. Additionally, occupational therapy can enhance an individual's body awareness and their relationship with others, essential visual skills for reading and writing, and promote the development of play, coping strategies, self-help, problem-solving, communication, and social skills. Have you ever wondered if you struggle with any daily activities? Do you know someone close who faces these difficulties or shows traits of the autism spectrum? If your answer is yes, it's important to consider the assistance of occupational therapy services. They are highly effective. If you enjoyed this video, please give it a like, and don't forget to subscribe to our channel. Your support enables us to continue creating high-quality content, especially for you.